That Naturopathic Podcast. TNP.
Hello there.
Hi, and thanks for joining us. I'm Dr. Cara Denisio.
And I'm Dr. David Miller, and we hear your frustrations. This show is for you.
This show is for you if you're feeling like your current healthcare strategy is not getting to the root cause or the underlying reasons for your health.
This show is for you if you've been told that you're fine, but you definitely don't feel very well.
This show is for you if you're walking out of your doctor's office with 1, 2, 3, 4, or even 5 medications without any mention of diet, lifestyle, or a long-term game plan.
This show is for you if you've got several specialists taking care of you, but no one is really putting it all together.
This show is for you if you believe that health should be part of healthcare. These problems have solutions.
We know it.
Our patients know it.
And we want you to know it.
Naturopathic medicine is the solution that you need to know about.
Okay, welcome to another episode of That Naturopathic Podcast. We're doing our Elder Series where we're all students with Dr. Verna Hunt, chiropractor and naturopath. Needs no introduction. I've already given you one last time anyway. So Verna, what are we going to talk about today? It's a word that we both independently have used. We talked about it earlier.
We asked the question, are you swampy in your body? Are you swampy? And that's about the lymphatic system, which we're going to explain what that means. And we're going to teach you a little bit about how to optimize it and watch for signs of having a swampy lymphatic system, because it's like a sewer. It's like a tiling in a drainage field on the farms. It's something you want to have working. Otherwise you feel swampy.
Underrated sort of system, and maybe like are there like lymphatic specialists in conventional medicine? I don't know if there is, right? You've got your cardiologist, you got your endocrinologist, you got all your every other ologist.
Mm-hmm. Well, in cancer therapies, there is a lot of lymphoma. And so in that way, they're concerned about what then has happened in the lymph system that has abnormal cells. But as far as there are people look at it, but they include it with hematology, I think, with vascular people. Right.
So when we're talking about the lymphatic system, like I said, it's a sort of underrated system, doing a lot of dirty work, I guess, for us all the time. Mm-hmm. Can you give us a little bit of like a little primer for those listeners who don't know exactly what we're talking about with the lymphatic system?
Mm-hmm. Well, first of all, I'm going to tell you how you might have had a lymphatic problem but didn't know it. And it involves a lot of soreness. Your skull and brain can be sore. It's like when your brain feels too big for your skull. And you think, if I could just drill a hole in my skull, I'd feel a lot better. So it's like a hangover. Many of us have had hangovers. And that hangover could be alcohol. But for people who are really sensitive, well, not really sensitive to foods and things, it could be some people too much dairy, too much gluten, too much sugar, too much sodium chloride salt as opposed to real salt. And so you can have soreness, like women can have soreness in their breasts before their period. But it also can relate to fibromyalgia, where everything hurts. You take a step, everything hurts. And it also can relate to things like constipation and diarrhea. So the lymph system is everywhere in the body, just like we have arteries and capillaries, that the arteries send the blood to the cells. We have trillions of cells, and then the nutrients kind of ooze out and go to the cells, which could be food things, glucose, natural glucose that we make, and vitamins, zinc, vitamin D, whatever it is. And then the debris comes back into these capillaries, and then through the little vein capillaries, it brings back a lot of debris, but only 70% comes back through the veins, 30% comes back through the lymph. And where you have a vein, you also have a little lymph channel, and they're clear and colorless, so they can be cut. You can't even really recognize them. Say you were having surgery done. So a really good example of that is having knee surgery, and a lot of people are having knee surgeries they cut all the lymph when they're taking things out and putting the prosthesis part in, and they really have troubles reestablishing that drainage through the knee. And David, you probably have seen people after knee surgery and what happens, but it really isn't pretty. So we're going to talk about those kinds of things. So 30% of the sewer water comes back. And what is that sewer water? It holds debris. It could hold dead parts of cells or dead parts of critters, like a cold virus, whatever virus means to the COVID world now. But, it's debris coming back that is too hard on your system. So it comes all the way back from the legs. So it comes up the legs, up the arms, up the belly, and then it forms a bigger duct, they call it, like a vein would, but comes up inside your ribs and dumps into the top inside into your main vein that then goes to the liver and kidney, and it sorts it out. But it's carrying toxic cargo, and it often encapsulated in some kind of mucus. We make 5 liters of mucus a day in our body, and then we disintegrate it and build it and disintegrate it. So that's a lot when you think of 5 liters. And so
some of it's pathological, right? And some of it's just metabolic waste, right? Like
right.
They all get lumped into the same, right?
Right. Yeah, it's like flushing the toilet, right? Mm-hmm. It's like it's going out. You just need it all gone. So our body, about 70% of it is water. And if you think of where would we cut you off if it was 70%? Somewhere in the upper thighs, or, you'd just be walking around with feet. Like, really, it's a lot to consider. Like, water is so important, and that might be a topic for another day. But the lymph system needs water. Everything needs water, but the lymph system needs water to get the job done. Otherwise, you've got gluey. And that's when you start to get sore. I'm going to take a sip of water. Sore, and some people will dry Toronto air. Some people will come in and they say, I wake up every day at 5:30 with a backache. What does that tell you, David?
Well, maybe something going on in the cisterna chyli, or...
That's right. So do you want to tell people what that is?
No, but I had this great teacher named Verna who told me a lot about it, and I'd like to defer to her. But I do know that it's a pretty big reservoir that I don't think in our anatomy training we got. They don't talk about it. They don't emphasize it very much. But I do remember it being quite a large, a cistern of lymphatic.
Yeah. So it sits in front of our sacrum, which for people who don't know what that means, it's the big bone that is the tailbone, right lower in our belt. It's an upside down triangle. It has a little curve in it. And in front of that, since sits these little channels of lymph that would kind of look like little streams coming into a river, is what it would kind of look like. And in front of that sits some muscles, and in front of that sits the bowel and the uterus, if you have one, and a small intestine. So there's layers of things in there. Between our belly button and our backside, there's a lot going on. There's no spare room. Everything has a place, and it should kind of move around. It shouldn't be like solid cement at all, except for your bones. You want them to be strong. So all of that gathers, and then it makes this channel that comes up and dumps. So sometimes I have seen people come in with a sore shoulder that's chronic. And when I examine them around their top rib cage, which is right under the collarbones, where that lymph should be dumping, it's all clogged. And then you'll see the ribs at the back and the upper ribs when you think somebody's hit you with a knife in there. And people say, I've got a bad shoulder. And I always say, has it been swearing? What makes it bad? But it's off its rocker. It's off its coat hanger. And it goes in weird places, and it's hard to sleep on, I can't sleep on this side, all those kinds of things. Mm-hmm. You have to look at the lymph because it's clogging somewhere. And it's one of my passions because it's often the hidden secret things that nobody can figure out.
Mhm.
But if all of the junky fluid isn't moving well, then you can have like Achilles tendonitis. I'm not saying that's the cause always, but it can happen.
Mhm.
Especially fibromyalgia or inside knee problems. Often we don't get problems on the outside of our knees, but the inside, all the drainage, more congestion for prostate. And then chronic, like even in little kids with all their earaches, it's related to that because it's not draining down from the ear. And that's how I first got interested in it over 40 years ago. Is these little kids come in screaming with earaches and their parents trying to avoid antibiotics. But what do you do? So there are things like lymph cream, which we'll come back to, and what happens there. Have I answered your question, David?
Yeah, I mean, I want to talk a little bit about like how thin the lymph is. I think you talked about that. Like it's very thin. It's almost like, is it just like a cell or two thick in some?
Yes.
So it gets overlooked, and this happens in anatomy a lot. Like size of things matters. So when they looked at, I know this from the Barral training, general anatomists won't look at the ligaments that hold the organs together as very significant because they're not very big compared to like the patellar tendon. Well, of course it's not as big, so they get overlooked. And I just wonder if the same sort of bias sort of happened with the lymph, because like you said, it's very tiny, but it's so important.
Yes, it's seemingly very delicate, like spider web delicate, but we all know the strength of a spider web, and it catches bugs and all kinds of things. It can hold the weight of the spider. So we have
no pump system too, right? I think that's important to say
that
too.
Is very important.
So that's where your Swampy idea comes in, and movement,
that's
right?
Movement, all movement. So when people say I have a backache at 5 a.m. every day, it's because they haven't been moving all night and the lymph isn't moving. Whereas if you say I have a backache only when I run, that's probably a biomechanical problem, right? So when people say, oh, I wake up and my arm is aching or anything, you'll think, well, they've been still all that time, unless they're sleeping like a rototiller, but they're still, and they're sore, and they're like, they feel creaky. They can't, they go, oh, again. Even young people, oh, I can't stand up. And right away, I know it's the lymph system, but it took me decades to figure that out. I thought, what is going on in there? Which is always the best question for a doctor to have, to think about. What are the possibilities? So if your sewer isn't working, just like if your toilet isn't flushing in the house, how long do you want to live in that house? Not too long. Or you want to get an outhouse or something, but you don't want to be there. So the lymph is very delicate. It's see-through. The vessels are see-through. They will mend after a time, like surgery, but it takes quite a long time. Doesn't take as long as nerves, but it does take quite a long time. And sometimes they'll get about 80% better. And then whatever the issue has been, that last 20% takes a long time. But they're happy with 80% when they've had maybe 5% function of a foot or whatever it is. So, so there's, bones, skull, fascia, all kinds of things that involve the lymph. It's everywhere. It's your drainage. Just like if you were watering your garden, you wouldn't want the water to go just in one spot. It seeps through all of the soil. That's what you want to have happen. So we have these lymph channels and we have nodes. So when the drainage of this kind of gooey liquid comes along, a little sticky, it goes in the lymph nodes, and there's certain special things in the lymph nodes, especially in the large intestine and the small intestine. They're called Peyer's patches, P-E-Y-E-R. But there's these little nodes, and magically, it seems, that's where people start to form antibodies. So sometimes you can have a sore belly even to touch when when people are, I'm very sorry about this cough. When people are, say, fighting off a cold, and they can produce a lot of snot and phlegm to bind all that, but it still has to drain out, or you have to cough it out. But you see that with little kids with ear and all that stuff. They hork out mucus, so to speak. And it's quite sticky and so on. So you can, it all comes in this way. So you have these lymph nodes, you have them under your jaw, you can have them in your armpits, you can have them in your groin, but sometimes it can be down the inner thigh. You can have all of these places that make very special, what we would call antibodies. So the next time that thing comes around, you'll be, oh, okay, that intruder is in here again. That ragweed pollen, or say, whatever it could be, it recognizes. And that's what we want our immune system to do. The lymph system is very important to the immune system. So that's why I have people do skin brushing. So in the Scandinavian countries, they use loofahs and birch leaves and all kinds of things. But if you Google skin brushing, you'll notice that you brush everything towards the middle, towards the belly, heart area. And of all the lymph in our body, 70% is in the gut, because that's where immunity starts, is in the gut, in a baby. So, rubbing your gut in a clockwise fashion. And that's why when you put castor oil packs on your gut, or in women, I say, include your breasts if you're going to do it to your gut, boobs to pubes. And
I was going to say, you got to say boobs to pubes. That's what everyone will remember.
Yes. And so the castor oil molecule is very small, and it just soaks in to inside the body, and it will break down scar tissue. Like, say 20 years ago, a woman had a C-section, and she's always had this little pull in one part of the scar or another. And if you put castor oil on that, and it's a little sticky, so wear an old t-shirt, don't care about, and go to bed. You could put heat on it. But some of us are lazy and or urgent. I'm kind of, I don't have time for that and whatever. So I just rub it on, and it helps break up the scar tissue. So that's a great, great thing for scar tissue. And then it all oozes out through the lymph. So for example, recently I had a woman come in with a low back problem, and I'm feeling around her sacroiliac joints. And I feel this like big wad of dried up double bubble gum. It felt like it was an old scar. I said, you've injured yourself here. She said, well, 30 years ago, I fell down some steps and really hurt myself. 30 years. So that was really old and dense. So I rubbed it medium.
What are you feeling at that point, Verna? Are you feeling the joint space? Are you feeling one of the bones? Or what
I'm
are you
feeling the tissue right at in that case, lower left SI. Okay. It was like a wad of gum.
Yeah.
I'm going to have a slippery elm lozenge. Good advertising for
a demulcent, one of my favorite grandma medicines, demulcents.
Tell them what that means, David.
A demulcent, well, I like to go with word origins. Sometimes they tell us a lot, and the word origin means it's Latin for to caress. So the demulcent sort of caresses irritated tissues, and most people know about Aveeno, like that cream Aveeno, which is made from Avena sativa, which is oats, and so people understand oatmeal with that slippery sort of mucilaginous stuff. So yeah, just very soothing. So Verna's soothing her throat with a demulcent.
Yes. I work in a building that doesn't have what do you call that, humidification. Anyway, well, this is kind of embarrassing. Cough, cough, cough. Anyway, where was I, David? Castor oil packs. So that can really help the lymph in around your gut, because it has a really big job of guarding your body from whatever it is you ate or didn't eat, I suppose, about what's going to then go to your liver. Then your liver has to filter it. And then eventually the kidneys filter it. There's a lot of filters in the body. But on a cellular level, the lymph has a job of what you call water that's around the cell, and then there's water in the cell. So the ratio of water inside all the cells to outside should be 60% inside and 40% outside. And things get carried in and out of the cell with minerals and other ways, but minerals are really important. Now, if you can't get it out, you have to look at the cell membranes and what they're deficient. It could be good oils or protein or selenium. That's a mineral. There's other things. And then if you get that ratio switch, so you've got 60% of the water outside the cells, it's like your sewer, your toilet isn't flushing quite as well as it should, because probably the filters, the liver and kidneys and other things, are not filtering well because they're clogged up with debris or medication debris or pollution, just what they spray in the cities for supposed
or just regular end products, right? Like regular metabolic end I always feel like that gets forgotten. Like there's all this other stuff for sure, but just making energy, we make waste no matter what sort of perspective you're taking.
Right. Yes, that's right. Yeah. So,
but what are the signs, Verna, that if someone's listening, they're going, I don't know if I'm swampy. What are some of this, like, okay, we've got pain in some of these areas that you've pointed out. We'll have to get back to the, was there anything else to talk about with the sacroiliac bubble gum, or?
No, it was just, what I knew had to happen there was the body had to break down that tissue, and I needed to adjust them. And I had them use some arnica cream and other things, but I also said, I'm going to put castor oil on this because it calls upon the T cells to come in and gobble up debris. So then we can get rid of, the crunchy granola or whatever it is that's sitting in there, because it was interfering with the mechanics. And so she was developing a gimpy way of walking,
Yeah. Is it best combining the castor oil with some kind of manual therapy at the same time, or is it something you just put on topically and let it do its magic?
Let it do its magic. I mean, I don't apply lots of things to people while I'm working. Yep. But there are exceptions to that. But it's such an easy thing to do. And I rub it into my hands really often because of the work I do, because my hands have to be soft but strong, all those kinds of things.
Yeah, when I was on my soccer days are long gone, but when I was playing soccer towards the end, I was using castor oil for sprains and strains, and a couple of guys were sporting enough to give it a go, and they said it was amazing how well it helped with just recovery from injury. So I thought that was interesting too.
Yeah, it is. It's really interesting. Now there was another thought there I wanted to capture about the bowel and the lymph.
Pear's patches you talked about.
I'll come back. It'll come back.
Okay.
Yeah. So, yeah. Oh, how do you know when you might have a problem? So this is one thing that women really relate to, and some men, they'll describe a problem. I said, does your whole body or in that area, do you feel poofy? Poofy. And they understand exactly what I mean. Often it happens to women premenstrually, but you can have a chronic thing. Ever since I had my first knee replacement, from the knee down, my foot feels poofy, a little gushy when I step on it. It's almost imperceptible, but there's something about it. If the tissue's poofy, and this isn't, I had this happen with a man who's like really tall. He's in his early 70s. And ever since he had the surgery, he was happy with his knee, but he had this poofy leg. And it kind of made him feel just a little unsteady, like he was a gardener and a farming kind of guy. So you want the lymph, which all got mashed up and cut in the surgery, and it's backflow. It isn't coming through. So you rub it around the knee and on the whole leg and put on some old sweatpants and, away you go. So there's this puffy feeling. Do you know what I mean, David? Do you know?
Yeah, I know what you mean. And even like some naturopaths would probably understand, if they understand some of the older stuff, like the lymphatic constitution, that hydrogenoid sort of, is that sort of the same idea what you're talking about?
Absolutely.
Yeah.
Absolutely. Absolutely. So they're carrying around, and, talking on the physical and metaphysical or non-physical, people who are display is quite emotional, the chemicals that you make with anger, rage, bitterness, despair, hysteria are very toxic. And even if you try and suppress it, and some people do, they'll come in and I'll touch their body, and they could, some of them are tiny, beautiful, or very athletic or whatever. And I touch them. I said, "Oh, you're poofy," and they go, "I am. That's a good word." and sometimes it's just sections of the body. The diaphragm up, the diaphragm down.
Yeah.
Just in the upper limbs, just in the lower limbs.
Which tells you something too, right? Like as a clinician, you're going to be
have to think where that drains to.
Yeah, exactly. So I think you just touched on it, but I think it's really important. Yeah, I think if people understand that all of the lymph drains into those thoracic ducts, that's really important, right? So, yeah. And so if they're blocked, I mean, I guess that's where you start, is it not?
That's right. So if you can find your collarbones, which everybody can find, and you feel underneath them, people often don't realize those are ribs right there, but you just pump on them like you're pumping on your cheek, but you're pumping. You don't pump hard and you don't poke. You just pump them. Or one hand onto the other side, one hand on the other side. Pump, 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 pump. And then you can do your skin brushing, which gets it all activated, or you can go on a little rebounder. Or I have a what I call the jiggle machine, where it alternates sides and you jiggle on it.
The jiggle machine.
Yeah, T-zone therapy. Or there's other brand names. That's a brand name.
Okay.
And it's what was invented for the astronauts, because when they're on the sky station, or whatever you call that, a space station, they don't have enough gravity and movement to keep their lymph moving. And sometimes their blood even backflows a bit, which is not good. And so that really helps to have that movement as if you're walking, and all the lymph will start to move. So, I've used a jiggle machine, T-zone, since 2009 when I first saw them. Mm-hmm. And I have another technology called Beamer, but I'm not going to talk about that a lot today, but it really helps with that action of the lymph and the circulation to return. But they're designing things for NASA now, so that's why I thought of it for the space station guys and girls.
But how long does it take before? Here's what I struggled with when I was younger, and I have to admit I still struggle sometimes with treating lymph properly or incorporating it into a comprehensive sort of plan for someone. Is that it's so subtle. You're like, you know that lymphatic, you've seen these courses on like lymphatic drainage and stuff like that. The touch is so light, and it seems so, it's like, there's no way that's doing anything. Can you give us any insight into like how maybe that light touch is still doing something?
Yes, it is. I'm trying to think of some really simple examples. I have a clinical one that would help you understand it better, as I know you do osteopathic stuff now. When someone's lying on their back and you're on their belly and you're trying to affect what's just in front of the spine and pelvis, you don't just poke in, you put your hands on, and then you slowly apply pressure and you begin to pump in some manner, right? Is that what you do with it?
Yeah, well, I invite the tissues to my hand is sort of the mentality that I'm going with.
Yes, yeah. Very good. That's very good for cranial work too, subtle cranial work. I had a lot of trouble with that. Being a chiropractor, I wanted to really look at it. And so when I just put my hands under the skull and I waited, then I thought, oh, I finally felt that. It took me a long time. So sometimes you just have to present. My greatest example of that is newborns who are having some kind of trouble sucking or something's wrong. And so I do craniosacral work on them, and I just put my hands there, and whatever it is they want treated, they'll push that part of their body right into your hand. It's an amazing experience. And then when
we've only done a couple of these episodes, but like you use newborns as a standard.
Yes.
For how it's supposed to be, yeah.
Yeah. So here's what I tell people. If you drink a good amount of water that you should every day, a good water, and you skin brush, maybe not every day, maybe 3 times a week, half your problems will be gone. I don't care what's wrong with you. your sewer's working, then your body...
Hold on. Repeat that. That's worth repeating.
Okay, you drink half your weight in fluid ounces of water, unless you are what I would call have abnormal adipose tissue, which is fat, obese, and we have a lot of obesity. But if we denigrate obese people and they weigh 300 pounds, so they have to drink 150 ounces of water, that makes no sense. Their kidneys are going to croak. So I say, what do you think your ideal weight is? And they might say 160. Let's say 160. Well, that's 80 ounces of water. So that's 2.5 liters. That is a goal. It takes a while to get there because you don't force feed yourself water because you'll just be peeing in your shoe. And your cells that are trying to get things in and out, they're going, who's being so pushy here? That kind of thing. Mm-hmm. So,
and dry skin brushing, you said that, and dry skin brushing will do what?
Take half your problems away.
That's a big claim.
I know. Try it. Try it for yourself.
That's a big claim from someone who knows. So,
well, if your sewer's working, then it's not screwing up all your metabolic processes, and things are getting in and out better. It's kind of like having full oxygen, Oh, good. Yeah. I can breathe in, as opposed to having blocked airways or like whatever.
Yeah.
And so it is something I made up. Do I have evidence-based research? Yeah, it's called practicing. But it isn't according to the standard. But if you can get people skin brushing and doing this other thing, it's like when you want to do washing clothes by hand, you have to really wring them out. You have to get them so they can dry. But if they can't dry, they'll be swampy too. Like they're just, that sweater still isn't dry. It's been 3 months, So you invite the water in, and the body goes, oh, we've got enough water. We can pee that out. We can get rid of that. But if you dehydrate and die, it knows that you're in big trouble. And that's why it's so important to sip water if you have fever, cold, flu things, because, and I don't mean force feed, I mean sip. Mm-hmm. And a lot of things can really be helped. Will you get over the flu faster? I think so.
Well, but there's actions don't really depend on water, or what healthy physiological conditions don't depend on water. There's so few.
Yeah. So if you put more water in, I mean, you could kill yourself drinking too much water. It's true. Anything can kill you. But if you invite it in, the body's going to go, well, let's get this out of here. Now, is that true if somebody's on a kidney dialysis? I wouldn't think so. That's a whole other circumstance.
Yeah.
I'm talking what you can do for yourself that's cheap and cheerful. Cheap and cheerful is important.
Yeah.
I mean, because...
Agreed.
And it has to become a habit. And teaching your kids to skin brush, because you can get those little mitts that are kind of bubbly, and they love that.
Okay, so what skin brush should I get? So my fiance, we're getting her. I was going to get her a loofah, but what do you think is the best thing to get, like at my local health food store, to start?
They'll
skin
have those
brushing?
little gloves.
Yeah.
They'll be colored. They're in a fabric that has a little texture to it.
Yeah.
And they're great because you can reach everywhere, and then you don't have to be hanging on to the thing.
Right.
Your hand is the thing. That's my opinion.
Okay.
I mean, I have other things that are long, and I have a long piece of fiber, something that I do my back with. But just for my body, like my feet and my nails, and just doing your whole finger. There's so many acupuncture points here. You can feel your body get excited and go, whoa, what was that? That was good. Do that again. Right?
Yeah. Yeah.
So and kids will think it's fun. And so say you had arthritic hands, and then you're trying to hold a loofah in this, and you just put these little gloves on and reached where you could. And in the reaching, you're getting exercise and stretching. So it's good for any age.
Yeah.
To do that. And the best you can, brush everything towards the center. There is a more complicated formula. And if you want that, great, go online and get it, because it's very available. Mm-hmm. But when you're doing something new, you don't need 20 steps.
And how are we affecting the deeper lymphatic? So we talked about cisterna carli at the beginning of this. So well, obviously I can't massage my sister Carly. Are we
Right.
making room for sort of efflux from that area
Yeah.
by clearing out the more distal areas like arms
distal.
and stuff?
But there are other things you can do. One is just breathing, and this is what I say to people. It's one of my sayings, it isn't exactly polite, but you won't forget it sayings. And I say, don't breathe forcefully, and don't try and fill up with 100 gallons of air. I said, breathe into your crotch.
Mm-hmm.
So your pelvic floor is like a diaphragm. Your diaphragm's a diaphragm. You have a diaphragm in your skull, and the arch of your foot is a diaphragm. So
Verna, you're going to get us an explicit rating. I never would have guessed this.
What?
If you keep all these rude terms going on here, we're going to get an explicit. I'm just kidding.
Oh, I see. I didn't.
Yeah. I never would have thought. Kara would have been the one I would have thought would get us in that saucy trouble.
Oh,
anyway.
I see.
Yeah. Just having
Well,
a bit of
so
fun.
when you breathe in, and you can feel your pelvic floor opening a little, you're breathing in. And if you're standing, you will actually feel more pressure on your arch. And we're not so aware of in our head, but if you put your tongue on the roof of your mouth and you breathe in, you will maybe feel it come down a tiny bit.
It's like an intention, right? When you're saying, like, I always found that difficult in yoga. They're like, breathe into your pelvis or like your crotch, like you're saying, like, just so you don't forget. It's funny. It's more like just an intention, but I did struggle with it. So what do you say to people who go, like, what do you mean breathe into my crotch? Because maybe they're more literal or something.
So if you've ever had a poo that didn't come out very easily, and you kind of had to push down into there, grunt.
Mm-hmm.
That's what it is.
Mm-hmm.
More or less.
Okay. And I want to go back to something you said about the body sort of accepting water. And I wanted to see what you thought about, because there might be people out there who have this or clinicians who notice this, because I've noticed it in a couple of people. It's like the people who can't accept water, they drink water and it's like, it goes right through me. What do you sort of, what are your thinking processes going on there?
That's a very good thought. Very good question. Why is that happening? Why isn't it going into the cells? What's missing? Minerals that are highly absorbable, like pico-sized, which means so small you can't hardly think about it. But if in all the salt water you drink, say a glass of water, and it's not just, you try and have it as clean as possible. You put a micro pinch, like a little zit of Himalayan or gray sea salt, because that has all the minerals in it. But what is touted as salt, and it's been sold for decades, is mainly sodium chloride, which is 2 minerals. But if you have a satisfying salt, people say, I'm really bad, I eat a lot of salt. I say, let's see. And I go and get my salt. I said, you can pick, I have all kinds of really good salt at the clinic. I say, eat as much as you want. Begin now. And by the time they have a third or a half a teaspoon in, they're done.
Mm-hmm.
They said, oh, I don't want any more. I said, yeah, because your brain tasted that and it knows it's got what it wants.
Mm-hmm.
It's like eating a really good homemade hamburger that you made versus a McDonald's burger. Or it's like eating real food, like as opposed to empty food.
The satiety mechanisms are there for like real food. And I'd argue that even, I heard this, Jade Tita, I think that's his name. Anyways, he talked about satiety being like a good indication that you've eaten a food that's good for you. And I don't think we were taught that in school, but I use it now with patients. Like, for example, I eat oatmeal and people will say, oh my God, grains or whatever. But like, I feel so full for such a long period of time with it. I have great bowel movements and I go, well, how can I argue with that sort of satiety?
So it's a good
bowel
food for you.
Yeah.
Yeah. For me, oatmeal has never been a good food. It just makes me want to eat more carbs.
Uh-huh.
But if I have, say, quinoa or wild rice, not rice,
Mm-hmm.
but I don't eat a lot of carbs because my body got so confused by being fed that way. And I didn't drink water as a child. I drank fresh cow milk. So I was, because I was brought up on a farm,
Mm-hmm.
So it's taken me time to learn all of that. But if you put a food in your mouth and your body goes, at last, what took you so long?
Yeah.
I'm that way with guava juice. And I had to research what guava juice had in it because I'm not a big juice. But when guava juice just gets in my mouth, I go, well, it's about time. And it's manganese. That's what makes guava juice unique, which is all the stretchy stuff. And it's the only mineral involved in making glucose in your body and so on, the mitochondria and so on.
Yeah, so this is simple stuff, but I think it's important for people to note that, like, you know, we're fairly healthy naturopathic doctors, and oatmeal is a really good friend of mine, and it's terrible for you. And this is why those formulaic diets sometimes just fall flat on their face, right?
Yeah, and also to think what I say to people, what do you crave? Oh, they go chocolate. I said, oh, that's magnesium. That's why you want that. I said, and then I say, is it dark chocolate? Milk chocolate? I mean, I get really specific.
You think there's something to that?
Yeah.
They don't just want a treat?
No. I ask them what kind of chocolate bar they eat, or potato chips. They say I eat potato chips. I say, what's your favorite kind? Did I talk about this last time? You
talked to me. I don't know if you talked to. I don't know if we talked about it on like live or on recording. So tell me about potato chips.
Yeah. So potato chips, potatoes, there's certain things that make serotonin in the brain, which is one of your happy chemicals. And so potatoes is one food that does it. Anything that crunches, you know, when you want to eat crunchy food, and salt. So potato chips is the triumvirate of serotonin, release. But, you know, everybody wants the crunchiest chip, and most people, can I name the brands?
Yeah, of course.
So one is Miss Vicky's and the other one is Lay's.
What's so good about them?
They crunch.
Mm-hmm.
They're the crunchiest ones.
Yeah.
That's what people tell me. I ask everybody. It's really interesting.
You talk to me about this as like because my problem is if I have chips, I eat all the chips.
Yeah.
And so do you have a little like adaptation to snacking on chips for people that don't want to go like, oh, I never eat chips, because we know that that's going to fall flat on its face at some point too.
Eat your fiber and your vegetables and everything first, and then have a little snack.
Mm-hmm. Mm-hmm.
So you're full. Fiber makes you feel full.
Yeah.
You also could make your own oven French baked chips. Like you just cut them really thin and put oil and salt on them and bake them.
Well, you said there's something about potatoes in general too, right?
Yes, it increases the serotonin.
Mm-hmm.
There's a book about that. That's how I know that.
I love spuds. I used to be called Spud King when I was young. Maybe I needed more serotonin. Don't know. Still love potatoes though.
So there's something we forgot. Oh, the water. So puffy. That's where we were. Puffy. So why aren't
the water that doesn't get sort of assimilated?
Yeah. So what's lacking in the cell membrane? So cell membrane has 3 layers, and it's usually in some circular, like it's not a box, it's a enclosed blob of something, and then something goes on inside the cell. So the membrane has a protein layer, and it's surrounded on both inner and outer sides by oils. So if your oil nutrient in your diet is Frito-Lay Dorito corn chippy things, it's not good oil, right? But if you're having, good olive oil or good sunflower seed oil or avocados or people think oils are bad. They're not bad. They're not bad. Bad oils are bad. And you have to, they need to be cold pressed and all of that kind of thing. But, and coconut oil is very good for some people. They do well on that. Good coconut oil, clean coconut oil. And then there are many kinds of oils. People are connoisseurs of this stuff. So if you eat oils, you do feel very satiated. Is that satiety? How do you say that word?
Sated? I don't know what, I actually screw this up all the time. I don't know.
Yeah. Oh, here we are. Anyways, like if I can remember being in, in the early 70s in Europe and eating in Italy and France thinking, who knew food could taste like this? That kind of thing.
Yeah.
So you really want to have a little pinch of salt in your water, not so you'll even taste it. Just like our tears when we cry are salty. we're a salty animal. So we want good salt and we want good water and we want to sip it. And if you're drinking no water today, do not drink 2 liters tomorrow because your body will take it as an insult.
All us animals love salt. Like, have you seen some of the things that some animals will climb like 80-degree inclines to lick salt on a, I've seen this like in nature where animals will climb death-defying heights to get salt. Like
and they can smell that it's there. Otherwise they wouldn't do it. Yeah. So we want salt because the salt are the escort service in our body. It takes things in and takes things out. So to get certain nutrients into our body, we need calcium and sodium. And to get it out, we need magnesium and potassium. And that's why Epsom salts work, because they're sulfur for one and magnesium for the other, and they pull stuff out. And if you have a bath and you put equal amounts of Epsom salts in and apple cider vinegar, you'll get even more pull. I call it my fish and chip bath, salt bath.
How much apple cider? I love Epsom salts, but how much apple cider vinegar?
Equal amounts.
Oh yeah.
Yeah. Equal amounts.
Okay.
Yeah, and then I shower off after because I don't want to smell like vinegar all day.
Right.
Okay, so getting.
You didn't talk about. Oh, sorry, you didn't talk about the breast yet. I don't think. I mean, we're talking about lymph, right? So
yeah,
that would make sense at some point.
There's a part called the tail which goes up into the armpits. Here's what I tell women from a very young age. I say, when you're having your shower or bath, morning or night, get soap on your hands and talk to your breasts. Say, good morning, girls, or good night, girls, or whatever it is. I call them girls. And you feel them every day. And if something goes wrong, you will know because you've done this every day, just like washing your face, just like brushing your teeth. You don't avoid them. You go, you talk to your whole body that way. How are you doing, legs? Because we need to really engage in consciousness. So with there's more lymph drainage on the outer breast in the tail up to the armpit, and that's where women can get sore if they're estrogen and progesterone, but mostly estrogen isn't breaking down well in the liver. That tells me that their liver is part of the problem because it's clogging and the lymph is having to shove the debris somewhere. So breasts, or some people it's their thighs, or it could be anywhere. It could be anywhere, but it's usually where there's more flesh, so to speak. So then you can do skin brushing on your breasts. Don't be mean. You just brush up towards, or just with your hand, up towards your armpit. And then can do the same thing on their genitals. Just feel them, know what they all feel like, so that there's no lumps and bumps there, or swelling, this kind of, oh, my underwear doesn't go around my leg the same way, Be aware of that. But there's a lot of lymph in our crotch and all around. There's a lot of lymph. And sometimes if you have a C-section, or you have even vasectomy or whatever, some major lymph thing can get clogged, and then it's always just a little swampy, a little puffy.
Verna, what are you thinking when everyone's got, or when someone's got just systemically, like all over, they seem to have their lymph glands are sort of palpable and inflamed, or maybe not inflamed, but at least enlarged? Yes.
Well, they're not dumping somehow. There's some filter downstream that isn't working well.
Downstream being
liver, kidneys.
Right. And then does that mean you sort of, when you're thinking it with this patient case or whatever, you're thinking about starting with the more downstream, clearing those downstream things so you don't sort of move things above them and then they get clogged up? Is that sort of what you're thinking?
Yeah, that's what I'm thinking. And I do a lot of homeopathic drainage. There's different companies that have different things, but there's something like generally a liver combo. There's usually 2 or 3 bottles, but not necessarily. There is a wonderful lymph drops that many companies from Europe have. But before that, if they're constipated and their liver isn't working and they look kind of yellow, we got to start there.
Yeah.
And if their biome is like, Twilight Zone or something, you have to get their gut happy. And happier. So, I don't dig deep, but if they're really, really lymphy, I will, probably give them some lymph drops, maybe not first time, but maybe second time,
Mm-hmm.
and explain the lymph system to them and tell them what to look for, all these things, so that they'll be participating. And some people have a kind of negative propensity to have a more clogged lymph system as well. You'll see that genetically. I've seen it in families.
Mm-hmm.
And so there's things that can probably make it worse, bad lifestyle choices, like just even like makeup, what you're putting on your body, or the soap you're using, like what's in it.
Mm-hmm.
What is the
Especially
book?
those that stay on for a period of time.
There's
right?
what
Like
was that book called? There's lead in my lipstick, that kind of
I
thing.
don't know that one.
Yeah, it's a long time ago, but it's a good book. Yeah. So, what else I want to talk to you about here? Let's see. Yeah, we talked about the cellular ratio. Other things to do. Well, walking, and look up these vibrational machines, and a rebounder. Rebounder is a great thing. It doesn't have to be really hard. It's just a little bouncing. You can even sit on it and begin that way. Or some people wouldn't necessarily feel safe on a rebounder if they're really elderly or not moving well. But these machines that originally were developed for the astronauts do a very good job. I mean, my mom uses one every night because she wakes up, and if she's in any hip pain, she gets on a jiggle machine. She's 102, so other people can do it.
Mm-hmm.
Yeah. Red clover tea. Red clover tea is a great thing, and I have people use. It's very inexpensive. And you can pick your own red clover if you're out in the countryside. It's that green clover with a really reddy purple top on it. And you pick the flowers, and you can dry it. And then you put a couple flowers in a teapot, and then you steep it for about hot water, then of course boiling water. And then you steep it for not long, maybe 5 minutes. And then you can have half a cup or a cup, but don't overdo it because it really gets the lymph system going. But I do have people do it as a preventive thing, and have moms that are breastfeeding drink it. And then when the kids get older, I have them make peppermint tea with the red clover because it doesn't taste like anything.
Mm-hmm.
So kids like peppermint tea or other teas, but they really do like peppermint tea.
What is the red clover doing, Verna? Like, I've always struggled with this. What is, we have we talk about this sometimes off air, how we like to have, or we have a lot of colleagues, or there's naysayers who want everything mechanistically explained perfectly in some linear sense that is, okay, it's helpful at times, but doesn't always cut it. What's our best sort of understanding of what's going on with the lymphatic stimulants? Like, what is actually going on there, even if it's just what you think is going on in your mind?
Well, that's a really good question. I am not a certified herbalist for sure, and I'm sure I've looked at this up at some point in my career, but I forget a lot, actually, over 40 years. So I know in general that it will very quickly change the lymph from something that is stagnant and kind of rubbery to a softer, and I can tell there's more flow because it doesn't feel hard. Like some people get lymph nodes like in their groin or in their armpits or right under their cheeks here when they've been filtering something like a root canal. I've seen that so many times. Mm-hmm. So I have a cream that I use, and there's many types of this. It's called lymph cream. The one that I get now has changed its name to Cleaver's cream because it's the main herb in it. Mm-hmm. And you put it on under the throat and under the collarbones, or you could put it on your low back and then under the collarbones and all that kind of thing. And 2 nights ago, I woke up with my right ear canal hurting. and a little swollen here. So I just got up and put cream on it. And by the time I woke up 2 hours later, it was gone.
Mm-hmm.
So what is it doing? It's allowing the stuckness of whatever the debris in there to let go. It changes the quality of the resistance in the vessel.
Yeah.
Now, exactly how it does that biochemically, I would say I don't know. I just know experientially that it works.
I find that other creams have been really very impactful. I used one. What's the one by? I don't care. I don't care if we say the name of brands and stuff on this show. It was by Pasco, and it's Lymph-Diarol. That's what it was.
Yeah, Lymph-Diarol.
And I used that on a sty.
Uh-huh.
And I remember I just kept using it like maybe 3 days or whatever. And then I was in the shower and I just went and just sort of like scooped underneath, where the gland is there. And it just popped right out.
Yeah.
It was amazing. It's just like it just allowed that decongestion to happen.
Yeah. Yeah. And that can happen, the little swellings you get up the shaft of the eyelash. They're called something.
The meibomian gland or something like that.
Yeah. That will work on those kinds of things. And also castor oil when they get really big, and the castor oil will help it too. But lymph cream is great for ears and throat and all that.
And you'd always be applying near the thoracic duct too there just to make sure that
always under the collarbone. That's the destination.
Yeah.
And sometimes that's the problem. You think, what is the problem? And you trace it back. And they said, oh, yeah, I broke my collarbone when I was mountain biking when I was 17. And ever since then, this shoulder isn't right. If it's a woman, this breast feels more sore. Or you can go way downstream. Yeah. And you'll have a sore low back. Or the lymph nodes that are in our groin along our underwear line where it goes. If those are congested or there's been surgery there, then you could have a soreness behind the knee. You think, oh, this is a Baker's cyst, but it's not. Or it could be in the Achilles and in the foot.
It seems like treating lymph, whether it's your primary target or one of your primary things you're trying to treat with someone or yourself, if you're someone listening as a patient, it seems like a great sort of accompaniment to whatever else you're doing. That's right.
So when people come in and I listen to them, and I probably known them for a long time, I just say, lie down, because they can keep talking, but I start working. And I check their belly. I check both the whole belly, and then I check both right and left lower quadrant where the iliopsoas and sigmoid flexure are.
Yep.
So, for example, if the sigmoid flexure, which goes down and bends, and then it goes back and bends, and then it goes down again. I call it the design flaw for us Westerners because we don't squat enough to stretch it out.
Right.
So sometimes the big, deep bend of the sigmoid flexure is right down in the bowl of that pelvis. So you have to go and bring it back towards the belly button. And you do it quite gently unless absolutely necessary, where you have to kind of rip the adhesions off the pelvic wall. But you can do a lot of scooping. It's like scooping mashed potatoes. And then you have them put lymph cream there and teach them to do the scooping. And then they're pooping better. But you see, when it makes all those turns, it's not one dimensional. It can turn and twist and then come up and turn and twist. And if you have even a semi-hard stool in there trying to make those turns, it's like a 16-way turn. It's not a 3-way point turn, right?
Mm-hmm. So
you have to get it so that the fecal matter can flow out. And sometimes people have a drop pelvic vault because they birthed 6 kids, or they were lifting a lot on a job or whatever. And now I'm always checking people's, okay, keep talking. I'm just checking your belly here. And they're used to it now. But when I was first starting out, no, I didn't do that. I was cracking bones.
Yeah. And what about like a fecaloma where you have like a fecal sort of like a stuck piece of poop there? I hear about it in kids. I haven't seen too many. I've worked with people after they've had them. But what are you going to feel or see when maybe someone has like a fecaloma? Because I have a pelvic floor physio as a friend here in town, and she's quite aware of them, and I wasn't as aware of them. What's your sort of understanding of them?
I don't know that I have a conscious understanding, but I do move a lot of stuff around in that area, and it is something that is very hard, and I'm taking the torque out of the actual large intestine.
Mm-hmm.
It's you just get better at it. You have to feel about 1,000 bellies before you know what you're doing, but just keep feeling them. Just keep feeling them. So if it's hard and it's not just a little ball and it's got to maneuver through something that only has a certain diameter, you have to reposition it enough so it can come out with the most appropriate diameter for it to get itself out.
Mm-hmm.
Does that help? Does that
answer? Yeah. No, it does. I want to, I just love talking about the belly. You know, my thing with bringing up the belly, and we can talk about it. And I just think it's so important, and it just doesn't get as much. I think it's because it's hidden. I think we talked about it previously, though. It's because it's sort of hidden and gush, sort of like mushy and hard to feel, that it gets overlooked. But
yeah,
it's a good link between lymph and the belly.
Yes, because 70% of our belly is wrapped around 70% of our lymph is wrapped around our belly.
Yeah.
So if you do the castor oil and you just do that circular massage, and then, you know, me, I use this analogy of the bowl is the bones and the ribs, and the belly is the mashed potatoes, and you want it away from the sides. And with that analogy, it took me forever to come up with it, but the people just do it. Are some better than others? Yeah, sure. But at least they're doing something.
Yeah.
And they can do it for their children and do it for themselves. In fact, you can do it lying down or lying on your side or lying in a big bathtub full of water on your side, because in the water it's easier to do. It's a nice thing. And, you know, you can, when in doing that, how I started doing that more and more was I move uteruses upward too. So you can do that and you won't hurt yourself. But there's a whole massage technique that the Mayan Indian midwives use to reposition, and it works very well. Works very well.
So if someone's listening and they were smart enough to hear that you said if you take care of your lymph, it's gonna help your symptoms by half.
Lymph and water.
Okay, so I'm going to take you up on a bit of a lymph challenge here. And so what are the few things I can do day to day? Because we have to sort of chip away at this, right? It's not something you do. It's not something you do and you expect overnight a massive shift. So what are the few things that I have to incorporate into like a fairly sustainable lymph challenge here?
So drinking water. And if you don't drink water now, start slowly. People say water tastes bad, and so then I wonder, are their taste buds working, right? So that's
I wonder
about
their stomach.
Yeah. So if it tastes bad, I say put a little lemon in it, put a little lime in it, put a micro pinch of salt in it. Or for some of ginger lovers, which I am, I put a little slice of ginger in my water. So I put a little taste in it, not sweet, just some taste. And also begin skin brushing.
Okay.
Also mindful breathing. So you're breathing, you know, in kind of down to your crotch, and then you just let it go out. But it's not forced. It's not, it's not that. It's just you're breathing in. See how your ribs are expanding or not. Sideways. Like if you put your hands on your sides, are you breathing out against your hands, back against your hands? That's the one we really miss, is breathing into the back, where we have a lot of room to hold a lot of air there. And out at the front, are we breathing kind of like opening like a flower, you know, breathing. And it's really
good. Are you talking just like day to day? You're like throughout the day, just make sure you're breathing properly.
And if you're in anxiety, which we all are right now with COVID, you know, go to the bathroom for 3 minutes and just sit on the toilet, not do anything, and just sit there and breathe.
Cool. Yep.
And
I want to do something topical.
put on?
Yeah.
Yeah. So you can get some lymph cream. There's many kinds. My favorite is now called Cleaver's cream from Genestra Royal.
Mm-hmm.
There are others. Biomed makes one. Pasco makes one. And then there's one more. And you put some, you don't have to slather it all. You always put some under your collarbones. Then if there's anything in your head, you put it on around the ears, down the throat, sore throat, and get rid of a sore throat really fast. You can put it on your breasts anywhere, but up the tail from the nipple area up towards your armpit. If you, it's on your low back, on the groin where your underwear line is, or anywhere in the belly. And if you're having, say you're recovering from knee surgery, you can put it all the way on the lower leg, up the foot, up the leg, into the groin. All of those things. Or if you broke your arm and it's swelling, then you can do that. You can pump it. And when you're pumping lymph, it's like pumping half set Jello under saran wrap. It's very gentle.
Yeah.
It's very
Which has
gentle.
to do with how not dainty, but how fine the lymphatics are, right?
Yeah. Otherwise, they'll just take it as bullying and go into a grip. They won't let go because they think, okay, who's challenging me now? That's my experience of it anyway.
Yeah.
And I've had occasions where I had one person, an elder person, who I'm related to, have a flu really, and her whole shoulder was kind of dislocating in the ribs, and she was not doing well. And I sat for a very long time, and I pushed it as hard as you'd push your eyeball pressure.
Mm-hmm.
Not even nose pressure, eyeball pressure. And I just pumped that spot and pumped that spot and pumped that spot. And then something kind of almost went, and I thought, okay, the thoracic duct is finally
Weird.
open.
You felt it?
Yes, that's my recollection.
Mm-hmm.
I think I felt it. I think I felt it because the breathing changed. The person's breathing wasn't as anxious. They were semi-comatose. They'd been to the hospital and were told they were fine. They were not fine.
Mm-hmm.
And so so I just pumped it. And I've worked with babies, really sick, under 6 months old, and I've done that. And it's so subtle what I'm doing. But I watch the breathing a lot, and just what their body, if it's crunching up or letting go, or if they're almost shaking, like they're feeling shocky. Mm-hmm. And babies don't make that up. People say, oh, they're just acting out. I go, no, people aren't that smart when they're sick. They're not acting out. They're not acting out.
Okay, well, Verna, let's give you the opportunity to, because I know you have a little notepad there, and I want to make sure that we've addressed everything that you really thought was important for lymph and swampiness. Because if there's anything else to touch on, let's do it.
Well, your kidneys filter your blood 24 hours a day in your whole life. They work continually, and then you die. I mean, they don't stop. Otherwise, you would be in such big trouble. So there are little things you can do for the kidneys. For example, parsley or parsley tea, something really green. It works very well. And just eat that. Now, not everybody likes coriander, so don't feel like you should have to do that. Parsley actually works better, I think, on the kidneys. Other things that work on another filter, the liver, is just hot water and lemon. Mm-hmm. And beets, if you like them. Mm-hmm. Not everybody likes them. And sometimes it's just taste, but sometimes the body's telling you something. Yeah. I've met maybe half a dozen people in my career that can't eat salmon. I'm thinking, can't eat salmon? I love salmon, or apples. I've also seen that. Very unusual allergy, but they live in that body. If people tell you stuff, you have to, they prove that they can't be trusted for accurate information, you have to really listen to what they say.
Mm-hmm.
And skin brushing, let's see, lymph massage, walking, rebounder, red clover tea. No, I'm good.
Okay, you hit it. Okay, so then what we used to do all the time with Kara or whichever guest we were with was leave the show with one sort of take home, because there's a lot here, and again, I'm going to listen to this one again. But if there's one thing that you want someone to take home from this idea of swampiness and taking care of your lymph, what's that got to be?
Skin brushing and drinking water.
Mm-hmm. Simple.
Yep, simple.
Cheap and cheerful.
Cheap and cheerful. Cheap and cheerful is really important. And it's not because some things are expensive and you should spend money on it and do it. But when you can hand something to people that changes their health and gives them hope and they're in charge of it, you've given them a real gift. Mm-hmm. A real gift.
All right. Well, this is a real gift to me every time we sit down. We got a few more lined up.
Our next one's going to be, what is your body saying to you? How to listen to your body to determine what it is saying and who could help you figure out what it means.
All right. She's prepared, people. She's ready. Okay. So, Verna, thank you so much again. I always I learned so much. I just love listening to you, and I learned so much. So I'm sure other people are learning too. We'll catch you guys in another week's time with another episode in the Elder series with Dr. Verna Hunt. Thanks, Verna.
Thank you, David.